Hello everyone, my name is Marlene Cato and on my presentation today I'll be talking about behavioral disorder in the elderly adult. Aging is another stage of life. As the saying goes, once a man, twice a child. People experience aging differently based on their attitudes, heredity, or even their lifestyles. These are drastic changes within the elderly or the aged by the way of their physical attribute, their relationships, adjusting to the environment, behavior, and or their spirituality. The elderly population is on the rise, so to speak, by about 100% in years to come. This is when urgent care will be needed to toward their mental and physical health needs, especially in the developed and the developing countries of the world. Elderly people with mental disorder succumb to different types of behavioral changes that affect the brain. One such behavior is known to be aggression, which often comes with the disease. These changes can be stressful for staff like myself. The result of these behaviors are based on the amount of drugs given or taken by these residents or patients. Some of these behaviors are an example of restricted movements or mobility. They will have problems with their physical health. They are prone to develop disorders due to imbalance and age-related psychiatric changes in the brain. When we talk about support, this is when the family, friends, and the community come into play to give an helping hand or even to be an advocate for these aging elderly adults. We should also maintain a supportive attitude at all times toward these elderly. Monitor these elderly before and during the course of taking these medication because as we all know, too much or too little will lead to serious side effects. Studies have shown that elderly or the aged tend to experience more incidents of drug reaction to antipsychotics as compared to their younger counterpart or younger population. These elderly, aging people are being over medicated without the proper assessment. Pharmacology speaks for itself. These are antipsychotic drugs, antidepressants, mood stabilizers. One reaction that stood out for me was that these drugs are sedatives. These elderly people are becoming zombies based on too much drugs taken for all these behaviors that could be dealt with differently. Look at these side effects. What do you think? Constipation, for example. This can cause bloated stomach, vomiting, stomach ache, or pain. Another one would be poor attention span. This is when they become confused, unable to verbalize their words properly. They're unable to do the skills or things that they were able to do prior to taking these antipsychotics medication. Impaired memory is another one based on the studies that I've shown. I would like to end this note by saying, as a society, we tend to discount the fact that we cannot prevent aging. People should acknowledge the complexity and the challenges that comes with age or being old. When people aged, they bring all their beliefs, experiences, habits, and in some cases their differences that set them apart from each other. Doctors and specialists alike should know the prevalence of the diseases affecting these populations before drugging them into a zombie state. Let's not over-medicate. We should reinstate.